Another mistake that keeps cropping up is that at times people can have a bad station. You can have periods of time where you're not at your best. The important thing in these situations is to make sure that you don't let that affect the rest of your performance. So if there is something that you remember that you've forgotten to ask, or a station that you had no idea about, you can still pass your exam if you continue to do well. Whereas some people can actually be very negative in their own mindset, they can beat themselves up about it, and what that does is actually it reduces your performance in the forthcoming stations. So the best thing to do is to wipe it clean slate for the next stations. Try and focus only on the next station, read the instructions carefully, and try and completely forget about what's happened. That's how we would deal with situations, difficult patients in real life. If we've had a extremely difficult consultation where it's been emotionally draining, we talk about housekeeping. We talk about taking a moment out, refreshing ourselves, and then sitting back down and treating the next patient as a clean slate, listening to them. All the kind of things you would normally do when you go into a station. That can sometimes be a bit more difficult if you've had a really difficult situation or a difficult case where you think you've not done as well as you should have done. The other thing to point out is that sometimes we can be overly negative and we can be overly critical of our performance, and you may not actually have done as badly as you think you have. Certainly amongst our group of friends, we found that stations we thought we actually really messed up, and the ones that were really difficult, we ended up doing better than we thought we did. And it's often the ones that we thought, oh, that was quite a straightforward station, I should actually do quite well on that, we actually miss out marks on. So don't be overly critical of yourself. Give yourself an opportunity to perform well later on, and think positively.